Hello, hi. It's Kelly again. Today I'd like to introducing one of the herbal formula, and I think this herbal formula is for clinical practice. It was appears to well tolerated, okay, and has quite help to the patient. And I have several articles actually I read it, and one of my copy I think it was very interesting, and I want to introduce in this herbal formula. Okay, and first of all I want to show you. Okay, this one. Okay, this is I bought it from the Santin laboratory, okay, called 灵桂素甘汤, okay, and the combination, and they come 4 combination, okay. You know, actually herbal combination, you don't have to have a lot, but you got to you know, put them together right, and just a few of it would work for each other. Some one of help another one. Okay, one is Hanen fungus. Okay, another one is Bai Zhu, and there's a third one is cinnamon twist. Then 4 ones is Chinese necro rice called gan cao. Okay, and so we say 灵桂素甘汤. Okay. Actually, 灵桂素甘汤, it was the formula created by our old Asian herbal doctor. His name is Zhang Zhongjing. Okay, and he is actually very important. I actually talk about it in my last tapes. He has the special book called one is Neijing, one is he has created another one. I'm sorry, something in my mind. Okay, he has the important book he wrote. Okay, and those books inside have several formulas, and it was well used in coming with generation to another generation. And we will carry out his formula, and most famous formula 四君子汤. Okay, and there's other different formulas, and this is one of it. Okay, 灵桂素甘汤. Okay, I have the magazine from Fujian, because sometimes I went to China, and my father's hometown is in Fujian, Fuzhou. Okay, it's right next to Taiwan. It's the province most close to Taiwan. Okay, and airplane ride about half hour. But since they are not, we cannot do the direct flight. Sometimes, you know, I have to, you know, take Hong Kong and transfer to there. Okay, and take about an hour, a couple of hours. However, when I go there, sometimes I buy some magazines. Okay, and there's 灵桂素甘汤 is a famous formula from Zhang Zhongjing, from the Han Dynasty. Han Dynasty maybe 2,000 years ago. From his book 伤寒论. Okay, and in this magazine is Fujian General of TCN, April 2004. Okay, and they will introduce and this article and talk about this formula. Okay, he says 伤寒. Okay, that means if you feel nauseous and you feel like full under the heart area. Okay, and you stand up, you feel dizzy, and you are using this formula. Okay, and a few words they explain this formula. However, and they use in the clinical practice. In this one, in this article, actually I copied down. Okay, from Fujian Journal of TCN, April 2004, 灵桂素甘汤. Okay, and in China, they have the hospital just do TCM, okay, traditional Chinese medicine, and that's their the actually real patient. Okay, the first one is Lin, in 65 years old females, and he present the symptom is feel cold, especially his chest and back feeling cold. Okay, and this woman come to the doctor, say, this is actually interesting case, so I just read it. He said, come to the doctor, say, I told the doctor I always kind of hot body, so I always drink or eat something cool. And because my backyard has the watermelon, I just always to eat the watermelon until full, make it as the meals. But sometimes summertime he feel like the back is cold and chest feel cold, and have to wear very much clothes to feel but otherwise he always afraid the cold. Okay, and he went to the hospital, and they take the X-ray and the EKG and a regular lab. It was normal. Okay, so they just give her a diagnosis of I think a nervous nerve, like psychological a little bit. Okay, and so he feel like so he went to the lots of medication to try to treat this cold. It doesn't work. Okay, so he has like the symptom also pale. Okay, and always feel like the chest is feeling full. Sometimes have morning feel has a flame, like she have to go. Feel chest is not open. Also lots of friends. Okay, also if she eats something, feel like things don't go down. Also, like digest, not not much digest very good. Also, sometimes she has a losing bowel, like the bowel don't go very well, like whole body. It's just like a little bit liquid. Okay, and this is the diagnosis is a spring stomach yang deficiency. Okay, why I say yang deficiency? Because he present to us cold. Okay, and also have diarrhea. Okay, and feel cold in the chest and back area. And with the stomach yang deficiency, because he was always feel because the stomach always feel cold, Okay, and the tongue present is very white color, You see the pale tongue is more yang deficiency part. If you see the red tongue, So when patient come in present this symptoms, but you look at the tongue is red and lots of yellow, and you will not do it as a deficiency case. Okay, if have the all come together and it shows, okay, he is had lots of phlegm and cold, and but this patient was saying, oh, I'm in a hot body. I think he probably sometimes have dry, even though present a lot of wet damp, but he still feel like a dry and a bad smell on her mouth. So he always eat lots of watermelon, think his body is heat, but they represent to the correct diagnosis is the spleen and stomach deficiency, okay, and yang deficiency. So the doctor gave him 苓桂素甘汤 formula. Of course, the 苓桂素甘汤 formula is a full formula. 茯苓、桂枝、白术、甘草. Okay, we're talking about 茯苓. 茯苓is a diuretic effect. Okay, and I have other different the book and the magazine with also have a research on the 茯苓. 茯苓, we have to be careful. 茯苓is potassium preserved. It's not potassium. some diuretic effect of herbal supplement, for example, Fulin, when you take it and a patient take a diuretic with potassium preserve, spare type of the diuretic will increase the potassium level. Okay, so some of it, okay, and I have this book. Okay, I do it quick. Okay, Fulin. Okay, there's Fulin, 猪苓、车前草 3 herbal with preserved spare. Okay, spare the potassium. It's not too much. It really depends how much quantity you're using on the patient. But this 3 is not equivalent laces. Okay, it's equivalent. The laces is potassium drain type of the medicine. So it's not equivalent. It's not similar. Okay, it's not similar because this 3 herbal is potassium spare. Okay. And so one of the Fulin is very good medicine, very good herbal supplement. Okay, and they using with lots of combination and herbal formula. And the main would say the helping the qi. Okay, what is helping the qi? It basically drain dampness. So it helping when body has a lot of dampness, they feel heavy. Okay, so the main function is drain dampness. Okay, and combined with 桂枝, 桂枝is a similar twist. Similar twist has the effect of the warm up, sting and warm out the body. Okay, so helping warm out the body. Okay, 桂枝. Okay, then it got the 白术. 白术 is also dampness. 甘草. 甘草 don't use it too much. Okay, 甘草 usually is like we use it to link. It's more like a lot of formula we threw up 甘草. 甘草 helping to like a hand hold the 2 herbal together. Okay, so we use a little bit 甘草. The effect to hold the 2 herbal together. Like in this formula, we use 甘草 and helping hold the 2 herbal together. Okay, so they work better. However, 甘草self has some a little bit, they will preserve the anti-inflammatory effect a little bit. Okay, so we're using a little bit. Okay, then 4 formula combined. The mainly we use the Fulin 桂枝 is the main. Okay, then 白术 is the assist, and 甘草 to put them together. The four together. Okay, and after one okay, they cook it all together for this patient. Then after 3 doses, and this patient has all healed and does not complain no more, chest cold and stuff. Okay, so in this case, present watermelon, and in the old book has explained watermelon is natural white tiger tongue. Okay, and white tiger is the pure yin and represent get rid of a lot of heat. Okay, so in this woman thinking himself has a lot of heat, he eats a whole bunch of watermelon and make himself gets worse and worse. And we use this herbal and this formula to treat this disease and use just the right direction. Okay, and the second case is heart palpitation. Okay, show you. Second case they present. The clinical case heart palpitation. Okay, is the man 61 years old in 2002 October, March. Okay, coming with arrhythmia. Okay, arrhythmia can have lots of reasons. Okay, we're not just talking about just if this chronically. Okay, and you should see of course, cardiology and EKG, all that. But what I'm talking about in here is in China, in old time, China don't have much, because China is big. Sometimes in the countryside, and they don't ever to get to the Western doctor that easy. Okay, and in this way, 61 years old male. Sometimes in China, they just go to this hospital. Sometimes it's like a Chinese herbal hospital. They build very good size, just like a regular hospital size. Okay, and he went in. He presented symptoms. Come and goes. Irregular heart rate. Okay, for 3 months already. Feel kind of empty in the heart, like a panic, little bit heart. Feel when this happened, when this arrhythmia, irregular heartbeat happened, he feel like chest feel kind of weird. Okay, and feel like a deficiency, feel like a space out. Okay, that's what he say, and dizzy. Okay, can you remember the first one when some Hanren say, if you stand up, feel dizzy, okay, use this. Okay, so he presented dizzy, but doesn't have a chest pain and doesn't have any dry cough, because some patient has lots of lung problems. Sometimes they have a chronic cough. Okay, and doesn't have a nice sweat. It doesn't have a flash, okay, and went to the Western doctor, and blood pressure is normal. With the EKG show intermittent atria, okay, sorry, early. Early. Okay, I because I don't know how to translate this. Okay, so that's what is mean. Okay, early beat. I think the beat. Okay, when they see EKG, when it starting beats. Okay, and the beats earlier. Okay, so you can like this. Okay, the interval shorten a little bit starting, so make it irregular because the starting early, and it's not from ventricle, it's from atrial. Okay, gosh, I'm sorry, I have to apologize my English. Okay, like this. Okay, I just spell atrial. Okay, it's not ventricle, not ventricular. Okay, so that's what EKG show on him. Okay, so in present, this patient has appears in slightly edema. Okay, and this things is come and goes. He used the medicine to treat in once they handle, and when this. But still, once a while, hit him, okay? And have some losing bowel sometimes, okay? And when you open the tongue, it's still a little bit pale tongue, pink color, okay? And you put the pump, post-diagnosis, you feel the pulse was deep, okay? And they check the blood and the urine was normal. Okay, so it comes to TCN diagnosis, spleen and kidney yang deficiency. Okay, yang deficiency, also yang deficiency. Okay, so they use the same formula to treat. Okay, so in TCN, we treat more like symptoms. We use a symptom to match the TCN, the formula. Okay, they'll have formula and tell you which symptom fit in this. It got to be exactly right. Okay, and in this one, on top of those 4 formula, and the doctor in the hospital at Zexie Chenpi, and also Gancao. In the Gancao was saying, Gancao was hold the 2 herbal together, right? But in this case, the Gancao, they make a Gancao, use 炙甘草. Okay, I want to show you the 炙. 炙甘草. 炙 that means they toast the 甘草. The 甘草 become toast. Okay. Actually, it's helping it give the 5 dose. Okay. The irregular heart rate has much improved after 1 month. Never repeat, never happen again. Okay, and in this case, he say he used ganjiang, also use ganjiang. That's always very heat. Well, you would never use ganjiang. Ganjiang is ginger. Okay, the dry ginger. You toast the ginger. Okay, and we use the ganjiang. We do not use it with the patient. They are more like no problem. Young people, they will make it dry. Sometimes they feel like, after the ganjiang, it feels so dry, we really heat up the body. Okay, so ganjiang used for young, only kidney young deficiency, usually elderly patient. Okay, and it will help a lot. But in this case, you got to put it all together in this way. Okay, so ganjiang 附子. 附子, 干姜附子, there's 2. Usually, 灵桂素甘汤 we don't add this 2. For this is particular case, if we don't see any very very weak body or something, we usually just don't use those 2. Okay, but we use those 2. We need to boil them first for an hour, then put another things going in together. So the real formula go down later. We boil the 附子干姜 first for about an hour and put another in because 附子 has a little bit toxic. Okay, so we need to cook 1 hour to get rid of the toxic. Okay, and they use 附子干姜桂枝白术. Okay, and 泽泻陈皮 that will helping get rid of the dampness and 炙甘草. In this whole case, it was used 灵桂素甘汤, but a little bit changing make them toast all the medicine, so the medicine become very heat property. Okay, and the third case is the woman 60 years old, the cough, chronically chronic bronchitis, also can use this. Okay, and the 60 years old, 2012, December 29, come to this hospital. This patient always intermittent coughing. Okay, especially in the winter time, cough so much, and 2 months ago, this patient has catch a cold and make it very, very bad, make a symptom worse because this patient is chronic bronchitis, a smoker, long time smoker. Anyhow, so he present a very pale in heart chest feel very, tight, and you see the sputum is a white color. Okay, with sputum, you see the sputum with color that maybe the cause is already infection involved, but this color is thick, is thin in white color, and also have a gas. You feel the abdominal. Sometimes you see people have a big belly, a belly. I see sometimes in the street, I see people have the belly area, and with the kind of little ball there, there may be a lot of gas inside. Okay, a gas inside, and also always has some diarrhea, and has pale pink tongue, and with very thick coating, white color. Okay, and diagnosis is spring stomach ion deficiency. Okay, and so we use the same. Okay, and we use ganjiang this time. Do not use 附子. Okay, I will not use 附子 if we don't see kidney ion deficiency. Okay, so we use the 茯苓、桂枝、白术. Okay, and 甘草. Right, and we just add on ganjiang. Ganjiang will dry up the phlegm. Okay, and 陈皮、厚朴, which is get rid of. They have the effect of helping intestine, move and get rid of the gas. Okay, and the cooking all together, and 3 dose, and his cough is gone. Okay, very very good, and start to eat more, and then the bowel become like a solid bowel, and this is 1 month they follow up, there's no repeat, no symptom was resolved. Okay, so in the come to conclusion, this is the standard 苓桂素甘汤 and treat the why, why symptoms, and maybe only 茯苓、桂枝、白术、甘草 for combination look simple, but if you can use carefully and add some on top of or cut one off, or and the result sometimes will surprise. Okay, and the茯苓with get rid of dampness is important for the phlegm and dampness. And gui zhi, which is cinnamon twist, is helping because it have spice, so it helping move the yang. Okay, and bai chu helping the spring and helping spring and get rid of the dampness. Gan cao is coordinate everything. Okay, so if a patient present has chronically stomach inflammation, sometimes feel cold on the full cold body and all extremity, and PP not very good, feel not float well, and with the tongue sometimes in pink. Okay, we can use this. Sometimes we use in a large area for this one. So I want to introduce in this one. Okay, 苓桂素甘汤, and remember, when we buy in orders for herbal, we need to have a very good quality, because qualities mean everything. Sometimes in this world outside, they selling the herbal supplement, lots not a very good quality one, and how they prepare, are they prepared in a sterile environment? Do they doing, if we do in a scientific way, they make a powder? Do they prepare in the environment in a sterile, right? And do they control the quality and quantity? I think it's important you find if you're too trouble to cook or something, decorate it, you can buy the scientist way. They already grounded, they already make a formula and capsules. But do they FDA approve? Do they go through the normal the exam process? It's very important, and to investigate that before you buy anything, because it may not affect if there's a fake. Okay, because there are lots out there fake stuff, and may not affect. Also, it's important, to see TCN practitioner to have them checking out, Okay, so I just okay, thank you. See you guys next time.